Hi, it's us again, Laurie and Lisa.
Lisa.
So we're going to talk about the benefits of rooming in, keeping your baby in the room, and what feeding cues you need to watch for.
So rooming in is a very important component to being successful with breastfeeding. Babies spontaneously awake and let you know that they're ready to eat. It's not really on any type of a schedule, especially in the early weeks. So by having the baby with you in your room, you're able to capture that and really act on those feeding cues. Here at this hospital, we do 24-hour rooming in, or pretty much as possible rooming in. We designed the hospital with that philosophy that we wanted to keep all moms and babies together. And contrary to popular belief, moms don't sleep any better when their babies are put in the nursery at night. Moms actually wake more frequently, and they wonder and they worry a little bit, how is their baby doing? So I'll just kind of put that myth to bed for you.
Yeah.
So by having the baby in the room, it seems to lead to more successful breastfeeding. Rooming in is actually promoted by many, many organizations. Some of them are the Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and many other ones. So this is well researched, and it really does lead to better breastfeeding and more frequent breastfeeding. By having the baby in your room, you're also going to be able to learn your baby's feeding cues. Things like rooting around or opening their mouth and sticking their tongue out. The mom learns to recognize the need to feed on demand. No scheduling, especially in the early weeks. It's very important that you remember that 8 or more feedings every 24 hours is the goal, and that really seems to do well with producing a good milk supply, preventing excessive weight loss in the beginning, and ultimately the baby should gain weight real well. Mothers learn to care for their babies and feel more confident by the time you go home. It truly is a whirlwind while you're here as a patient, and we see it all the time between all of the staff and things that they need to do, and then you factor in your friends and family coming to see you. So by having the baby in the room with you, you getting comfortable with the diaper changing, the burping, getting the baby latched on, all of those things will really help you a lot when you take that little bundle home with you. It also, as I said earlier, will help develop a really good milk supply if the baby isn't scheduled and that they're feeding just liberally and as often as they want to. There's no such thing as overfeeding your breast baby, so I tell moms all the time, if you're not sure, put the baby to your breast and see what they do. There's no harm in doing that. It also can help prevent breastfeeding complications. Two that come to my mind are clogged ducts and mastitis. And mastitis is a pretty wicked breast infection. And we find that if there's separation with baby, moms are more prone to that, or if there's scheduling of feedings, moms are more prone to those breast problems.
And I've noticed, having been an OB nurse for years and years and years, that we hardly see anybody anymore that is struggling with engorgement here at the hospital. Years ago, we would send women home all the time that had started having issues with engorgement. It was because they weren't feeding their babies enough. Now, we never see moms with engorgement.
Yeah.
You know, it's very rare and far between that women will have that complication with breastfeeding. And it's because they're allowed access to their babies 24/7, just feeding, and building that wonderful milk supply and learning how to breastfeed before you go home.
And I think another reason why we don't see a lot of engorgement is now moms are more educated on holding off on that pacifier and holding off on that bottle. And they know now when the baby wants to suck, not to give it a pacifier, but to put the baby to breast.
Correct. Yeah. So some of the things we want you to watch for, you got to really be a detective and learn what your baby is telling you, because the baby can't talk to you, but the baby is going to give you cues, and we call these feeding cues. And if you can catch the early feeding cues, when the baby is just first starting to stir, wake up, maybe putting their hands to their mouth, or what we call rooting, where the baby opens up and is reaching towards the blanket or something, that's the baby saying, hey, mom, dad, here I am, I'm ready to eat. If you wait until that baby is crying, now you've missed it. That baby's been trying to get your attention for 15 minutes and has had to escalate it to crying to get your attention, to say, I'm really hungry. And now what happens is you put that baby on the breast and it's exhausted and tired for working so hard to talk to you for 15 minutes. So we want you to feed that baby whenever the baby first starts showing those early feeding cues of licking, sucking its fingers, opening its mouth, even making little slight noises, cueing and cooing and wiggling around. That's that baby saying, hey, let's go, let's start feeding.
And if they're crying and they've escalated to that, then their frustration level is pretty high, and so they're not going to work with you,
Right.
or me or Laurie when we're trying to help you. They're not going to be as patient with us trying to work with them to get a deep latch. So that's another reason why you don't want to wait till a full-fledged cry.
Correct. The only other thing I think we wanted to talk about today in this session was about the research behind unmedicated deliveries. Babies that are born to mothers that go all natural, these babies are awake, alert, ready to go, and the research has shown that they actually breastfeed better. You know, they latch on, they're ready to learn. When we moms get medications, and we're not advocating that nobody gets medications. If you need the medications, you get the medications. But one of the things we advocate for is get it as late as you can and as light as you can, as little as you can, because we want that baby to be awake and alert and ready to go when it's born, because we're going to place that baby on your skin and, you know, let the baby go and find the breast right away.
So yeah, again, just to echo what Laurie said, absolutely, there's a time and a place for medication, but sometimes there can be other measures utilized before we jump to a medicated type birth. So be open to that. Do some research.
Yeah.
There's some wonderful
childbirth classes, all types of breathing techniques. We have wonderful nurses here that will help you work through labor, and we have all types of balls and stuff that you can use to help get you through. But if you need it,
And
we're
another
here to help
thing
with
that
the
comes to my
breastfeeding.
mind is, I don't know if you've heard of this term before, but some people hire a doula to come to the hospital
yeah.
and help
Yeah.
them. They're actually trained in labor, and do some research on that. So there are other things that can be utilized
Yep.
before.
So remember, we have our prenatal breastfeeding classes you can attend. We have birthing classes that you can attend. As Lisa said, there's doulas. There's all types of things out there. Just start doing your research and reading and be informed. All right, that's it
Thank
for now.
you.
Bye-bye.
Bye.